Neostigmine and pyridostigmine are used to treat myasthenia gravis. These neostigmine and pyridostigmine are more long acting ones. So they could be used to treat myasthenia gravis to increase the acetylcholine concentration in the synapse and increase muscle contraction. So those are direct, no, not direct, they are indirect acting reversible cholinomimetic drugs. Next, the irreversible anticholinesterase, they inhibit this acetylcholinesterase permanently. So bind to acetylcholinesterase and irreversible inhibit it. So examples are, as you can see, there are parathione, there's malathione, there's isofluropate, there's ecothiopate. So when you're talking about irreversible indirect acting cholinomimetics, necessary to know when questions come with agricultural OPC poisoning, OPC means organophosphate compound poisoning, or some toxic gas, which are respected side effects of parasympathomimetics. They are talking about irreversible indirect acting cholinomimetics. So what is the antidote? Antidote is, we use two drugs. First one is atropine. Atropine is mechanism of action is, it's a cholinergic antagonist. It's a cholinergic antagonist. Next is praldoxamine. Praldoxamine, what it does it do is it again reactivate cholinesterase enzyme. So in irreversible one, we irreversibly inhibit acetylcholinesterases, no. So in the praldoxamine, we again try to reactivate it. So that's what we do. In the atropine, what does it will block these acetylcholinesterase receptors, and it will inhibit the function of cholinomimetic drugs. So it acts as a anticholinergic drugs. That is why its mechanism of action is cholinergic antagonist. So what is the side effects of these cholinomimetics? So when patient come with like organophosphate compound poisoning, or patient is on some toxic gas which is related to irreversible indirect acting cholinomimetics, these are the main side effects that you can see in the patient. First one is diarrhea. Okay. Next, urination. Next, meiosis. Meiosis is mean contraction of pupil. Next, bradycardia. B means bronchoconstriction. This is very important. In the bronchoconstriction, what is happening in the parasympathetic state, relaxed state, you don't need more oxygen. No. In the sympathetic system, when it is activated, you need more oxygen to act. But in here, we don't need more oxygen to act. So in here, in the parasympathetic system is overactivated, there is severe bronchoconstriction. So less oxygen going into your system. Okay. E means emesis. L means lacrimation. S, salivation increase, secretion increase. So patient comes with diarrhea and urination, and when you check eyes with torch, it is constricted, and when you check heart rate is bradycardic, and patient is dyspneic, patient can't breathe, patient is like in asthma status, and patient is vomiting, and tears are going in his eyes, and more secretion comes from his mouth. So always consider, this is dumbbells, this is the main side effects of parasympathetic nerve system. Okay. So the irreversible indirect acting cholinomimetic drugs are the main causes. So contraindications, so this cause bronchoconstriction, no. When patient is having asthma, you can't use this, so it will worsen the condition. If patient is also is a asthmatic patient, you can't use due to this side effect, these cholinomimetic drugs. And also pepticals, mainly pepticals. Why? Because mR receptors are in the stomach. So when you use these drugs, it will increase mR receptors, increase intracellular calcium, and it will increase secretion. So pepticals will be worsened. And also mechanical obstruction of GIT, we know it will increase the peristalsis. So when some object is obstructing the GIT tract and you are giving drugs to increase peristaltil, it will damage the inner surface of GI tract. So you can't use this. those drugs when those situation comes, and also hypertension because it causes bradycardia. So when hypertension is there, so we are using these drugs and heart rate also will be reduced, no? So less blood is going to periphery. So this is what is happening. So those are the main basic things that we have to know about parasympathomimetic drugs. So we have to know what does it does and what is happening in the these um, synapse, right? What is happening, how does these drugs are going to affect, what is the main concept of these drugs, how these could be classified, where are those receptors, and we have to know the mnemonics. Okay, we have to know some drugs to remember what are the indications that we could use those drugs. Okay, what is reversible ones, what is irreversible indirect ones. So how do you treat these organophosphate compound poisoning and subtoxic drugs that which is relevant to these respective side effects. So we have to know the atropine paradoxum, we have to know. So those are the main things, and especially these dumbbells, very famous, these side effects. So and contraindications. So you can't miss. If patient is having asthma, you can't use cholinergic drugs because it causes bronchoconstriction. So it will worsen condition, peptic ulcer also, and mechanical obstruction of the GIT mainly. So patient is having severe bradycardia. You are giving cholinergic drug, it will worsen the condition. Could cause it could cause cardiac arrest. So also the hydrophonium we have to know hydrophonium for the tensidone test. So for the diagnosis of the myasthenia gravis, and also pisostigmine and neostigmine and pyridostigmine that are used to treat myasthenia gravis, which are more long acting one, and donepezil, rivastigmine, galantamine for Alzheimer's. So in the drug pain mnemonic also donepezil, rivastigmine, galantamine, DRG. So they are used for Alzheimer. So those are the basics thing that I want to talk about cholinergic drugs.